of Health and Family Welfare has formed 8 committees for the effective implementation of the central government's flagship health scheme, the Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana in the national capital. The implementation of the scheme was one of the BJP's key campaign promising, and the state government has now stepped up the preparation for the same. This comes after the Delhi government has signed a memorandum of understanding with the centre to roll out the scheme and directed more than 100 hospitals in the city to implement it at the earliest. Now, among the 8 committees, the government has constituted a state empanelment committee which will enroll the healthcare service providers, including government and private hospitals, alongside the 7 other committees that have been formed to smoothly conduct the hospital empanelment process. Mehndi Garg, my colleague, is joining me live to share more details. Now, Mehndi, the Delhi government has urged to form the 8 committees that are particularly going to look into the implementation and execution for the Ayushman Bharat scheme that has been the major factor for the Delhi government also to be imposed after it came to power.
Well, indeed, Simran, talking about the Ayushman Bharat Yojana, then yes, it was on the priority of the Bharatiya Janata Party even before elections, and most of the election campaigning was based on the Ayushman Bharat scheme as well. And now after Rekha Gupta government has taken over in the first cabinet, Ayushman Bharat Yojana was passed and discussed in the first cabinet meeting, and some days back also an MOU has been signed with the central government of the Delhi government to start and implement the Ayushman Bharat Yojana in the national capital as soon as possible also. And now the latest that we are tracking right now, Simran, is that the Department of Health and Family Welfare of the Delhi government has now formed an 8 committee for the effective implementation of the central government flagship health scheme, Ayushman Bharat Yojana, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, rather, in which the implementation is very important. The working of the hospitals is very important, and under the action plan of the Delhi government as well, and also establishing the Jan Arogya Mandirs as soon as possible. So yes, a lot of is there on the priority list of the Delhi government, but some days back also the Delhi government and also the Health Minister Pankaj Singh has informed and issued a statement for all the government hospitals to implement this Ayushman Bharat Yojana scheme in their particular hospitals as soon as possible as well. And now eight committees has been also made by the Delhi government to ensure that an effective implementation of this particular scheme happens in the national capital.
All right, Mehndi, thank you very much for adding more details to this. Now, viewers, on that note, that was all the news of the nation and the world. Will continue to track all the developments very closely.